Just about 16 minutes after the hour of 7 o'clock, welcome back to the Now Morning Show. I'm Kimberly D'Souza. The United Nations Sustainable Development Goal 3 aims to ensure healthy lives and promote well-being for people of all ages. Among its target audience or among its target goals, they need to reduce the premature mortality rate and the non-communicable diseases by 1/3 through prevention and treatment, and also promote mental health and well-being by the year 2030. Now, this morning we speak with health systems specialist Dr. Agatha Carrington, who many may remember as being the former THA Secretary for Health, Wellness and Family Development. Dr. Carrington, good morning. Thank you so much for joining us on Now.
Good morning to you, Kimberly, and good morning to our listening and viewing audiences. Good morning again.
No, I know that we are focusing on two things first. We want to delve into the Sustainable Development Goals, but I want us to talk a little bit about NCD because, of course, you know, we have a very, very high NCD rate here in Trinidad and Tobago. Now, just to give us a little guidance, what exactly are those non-communicable diseases?
So those non-communicable diseases are those lifestyle diseases like diabetes, cancer, hypertension, and the like. Those form the group of some of those non-communicable diseases. In terms of diabetes for our country, we know that we have 13% of our population affected by diabetes. And that is a major concern for us as a population and as a country. But this morning, I want to point to, in terms of the context within which I'll be speaking, just to zero in terms of the SDG agenda, right, 2015 to 2030, which sets the framework for us to work. And we are 8 years to go. There are 8 years to go to 2030. And there's much to be done. And I want to point to what as a country we have been doing and what as members of the population we ought to be doing or have been doing or should improve what we have been doing. So just to say that the goal that we're focusing on this morning is ensuring healthy lifestyles and promoting well-being at all ages. And to that extent, the expectation is that the focus be on reproductive health, maternal and child health, adolescent health, communicable and non-communicable diseases, and affordable medicines. And permit me to just quickly point to responsibilities on either side. So in terms of the commitments and responsibilities by government, government has indeed looked at policies and programs, several of them. And these, in the most part, have facilitated the strengthening of clinical care across many disciplines. We have looked at areas where you improve the access to medicines, just to name a few. And so these measures have sort of strengthened the framework within within which the population is expected to improve their health. And so I wanted to stay with that, not so much so speak about what government is doing. I just mentioned that in summary, but how does that relate to us as citizens, especially because we are pointing to the whole issue of health and well-being and how we can contribute to the achievement of this goal. So what is our role in all of this? We expected to maintain our focus on health promotion and disease prevention, more so in health promotion. And so let me just quickly point to what I mean when I speak about health promotion, because the extent to which this activity supports us in that we can increase control over our health. And that's why I want to stick with that, because if as a people we focus on our health promotion, we will be making a contribution towards the achievement of this goal, because it speaks to the engagement of persons, empowerment of individuals to adopt healthy behaviors and the like. And so that's why I want to stay with that.
Right, but Dr. Carrington, as we're talking about healthy life and healthy living, I mean, how do we get to that point? It's fine that we have the policy and it's fine that we're trying to keep with the SDGs, but then how do we get to the point where we're sustaining that healthy living?
Right, so that's the crux of the discussion. And so either singularly or collectively, we should have good health-seeking behaviors. What do I mean by that? We should utilize the health systems when we are ill and not delay access to competent care. Let me just say that this is not that the health system is not without its challenges. It is indeed so. But what should we be doing? we should exercise greater responsibility for health. In that, so be it the harmful use of alcohol or tobacco, how do we minimize that? Physical inactivity, unhealthy diets, those areas that require our attention. And so a commitment must be, as a people, to focus on how do we pursue a healthier body, a healthier you. And that means that we have to support or strengthen one of physical functioning through healthy diets. What do I mean by that? Looking at your nutritional intake, diets that are rich in fruit and vegetables and the like. And so if we were to do that, we will protect ourselves from malnutrition, the same NCDs that we were pointing to a little while ago. We'll boost our immunity, we'll strengthen our bodies, we'll keep our skin, our eyes, our general body will be healthier if we were to do that. So the focus has to be on the healthier diets, physical fitness and exercise, so we strengthen our body, adequate rest, reduction of alcohol and tobacco use. When we are ill, we go promptly to our healthcare providers such that we can access treatment. And I said earlier that there is access to medication through our CDAP program, which is the Chronic Assistance Disease Program that is free of charge that persons can access. But more than that, I think there should be a consideration in terms of some of the other factors. So yes, the physical functional areas, but what about the social domains, the support from families, your community and the like? What about the areas with respect to emotional and psychological domains, how we feel, how this impacts our lives, the cognitive issues, what is our understanding of the environment in which we live and work, how it supports your care. All of these are important, and the interactions between the physical, functional, the social, the emotional, the cognitive, all of these interact such that we could bring about the improvement we want to see. Right. So I want to table those because...
Yeah. No, yeah. To me, I think it sounds easier said than done, because of course we're talking things like, exercise, we're talking things like, drinking more water. How do we get somebody to that point? So for example, somebody who is really dependent on sugar, how do we help them to, make that transition from eating that to a healthier lifestyle?
So let me just say that this is by no means an easy journey, because we are talking about changing behaviors here. And so a person has been accustomed to having all these sugars and salt in the meal. What we're encouraging is that you minimize in your nutritional intake, you minimize these inputs in your meal. Yes, it is not easy, but we are encouraging persons to do so. Now, culturally, food is part of our culture, may I say, but that an effort has to be made, and that's why I spoke to accepting responsibility for your health. It is not just about, as you just said, policies and procedures. It's not just about what the government can do for you, but it's about what you can do for you so that you could improve the quality of your life if you were to make that gradual, I may say, commitment to accept greater responsibility for your health.
Yeah. And then, Dr. Carrington, just to drive the point home a bit, if we don't adopt this new healthier lifestyle, then what are some of the disadvantages that we're going to see playing out in our lives?
Right. Just exactly what we have now. The onset of these NCDs, which if we were to do just what I'm saying that we should do in terms of your lifestyle, if you improve, you will see an improvement in the long run. And this is not by any means a short journey. In the long run, we'll see a reduction in some of the diseases that we are seeing in our population. So persons will have strokes, persons have heart disease, persons have kidney disease, they have cancers. And I'm saying that a behavior, to change behavior is difficult. However, it is worth the while if we commit to making this gradual change in terms of what we do for ourselves. Right. Because when we do it for ourselves, we do it for our families, for our communities, and for our country.
Right. And so for those who may have already gotten these NCDs, is there a way that they can be able to live with it and even extend their lifespan?
So may I say that for those persons who are already ill, and we know that is the case, that there are services available for them. So, in and outpatient services in the public and private facilities, there are services available. And so that you can have not just a medication, but you also have access to medical social support so that you can manage the disease. This is a long journey, but however, if we were to start now in terms of that, and persons have started, this is not a new story, but I am just reminding all of us the importance of a healthy body, the importance of your contribution to a healthy community and a healthy population, such that we'll have a healthy society, right. So that we can minimize the onset of these NCDs.
Right. And Dr. Carrington, going back a bit, you would have mentioned that, because you have a healthy lifestyle, it also leads to, maybe, or I should rather ask you, because you are the expert, how can that also help with, let's say, mental health or somebody who has mental health issues? Is adopting a healthier lifestyle going to help with that? And of course, we are thinking in combination with other factors as well.
Sure. The health is not just about your physical health. It speaks to your mental health as well. And when I pointed to some of the other domains that are important for your quality of life, it does embrace the mental component. And so your emotional, and your psychological state, they are also important for the healthy you. So yes, we deal with the body, we eat well and all of that, but our emotional state is also important for the healthy you. And we encourage persons, and that's why I spoke to how we feel. Persons would point to how did I feel today, or what something might have impacted your social life. Some incident or event might have occurred in your family, and that would have impacted your feelings on that day. And therefore, the social support is important. The family support is important, both for your physical state and your mental state. And we want to encourage the support of our families on this journey where we are. One, we are saying accept greater responsibility for your health, but we are also saying, even if you can't, you rely on, or you ought to be relying on the support of family and of community as we continue this journey.
Now, you would have mentioned as well that the ministry has services available for people who have NCDs. Does this also include medication as well?
Yes, the Chronic Assistant Disease Program, and I'm not speaking as a staff member now because I'm not in the ministry, but I'm aware that the Chronic Disease Assistant Program provides access to medication. So you go to hospital, you can get them, and also in the private sector, because there's a collaboration between the private pharmacies and the central government in terms of the access to or the availability of these medications.
Right.
And also we have our outpatient clinics, yes, at which our patients can access services.
Now, this SDG, we have a huge task, right? We are hoping to have, that healthier lifestyle by 2030. Now, it may seem 8 years off, but do you think that we can achieve this by 2030?
It is a hope. It is quite difficult to do because we are talking about change in behavior, and behaviors don't really change overnight. It is difficult. But that it is something that we ought to pursue. It keeps us in focus. It keeps us disciplined so that we have something to work towards, especially because it will impact our population in a positive way if we can see some shift, some modification at least in behavior. So even if we don't see any full and fundamental change, any modification in behavior is one to celebrate.
Right. Well, Dr. Carrington, let me thank you so much for joining us on Now and just sharing about healthy lifestyles and about, of course, that SDG that we need to achieve by the year 2030. Thank you so much for joining us.
Thank you for having me.
And that was Health Systems Specialist Dr. Agatha Carrington, just sharing some information about healthy lifestyles. You're on the Now Morning Show. We have so much more coming up. Stay with us.